a consultant in rheumatology and rehabilitation medicine, and some years ago I did a master's in sports medicine. So my experience is quite broad. It covers all types of rheumatological conditions, rehabilitation of complex injuries such as amputation or brain injury, but also a lot of musculoskeletal injuries, so people with back pain or neck pain, shoulder pain, or sports and training injuries. Over the years I've done quite a lot of chronic pain management, and so I see patients with that as well. Rheumatology is the study and management of patients with arthritis. So predominantly inflammatory pain in the joints. So that might include things like rheumatoid arthritis or arthritis in reaction to infections such as reactive arthritis. It's a very broad topic, but predominantly people present with painful, swollen joints. As a consultant in rheumatology and rehabilitation medicine, I'm primarily involved in the diagnosis and management of people with musculoskeletal conditions and arthritis. But to do that, I have to work very closely with a multidisciplinary team, and pure sports medicine is particularly well suited for that approach. I see all sorts of people with rheumatological conditions, and that's predominantly things like arthritis, and that might be rheumatoid arthritis, or it might be arthritis which affects the spine, such as ankylosing spondylitis. But there are a variety of presentations of arthritis and a variety of treatments which involve the multidisciplinary team, or in fact sometimes medication, all of which can make patients feel better and get back to their normal way of life. So I think the key to success in any medical management nowadays is the optimal use of a multidisciplinary team, particularly in the management of musculoskeletal or inflammatory arthritis. And that's because the patient will benefit more from using the skills of a variety of different therapists and doctors to understand what the diagnosis is, to identify what their particular problems are, to isolate their goals and to achieve them so that the patient feels better. I spent a long time in the army, and I joined as a medical student and then did a period of time as a general duties medical officer with an infantry battalion before becoming a core medical trainee, completing that training and then specialising in rheumatology and rehabilitation medicine. And I did that because I was inspired by one of my senior colleagues who suggested I try the specialty, and I was surprised by the fact that I particularly enjoyed the really complex rehabilitation challenges that we had with our patients. I became a consultant in the two specialties, firstly at the Royal Hospital in Haslar, and then at Headley Court in the Defence Medical Rehabilitation Centre. And that was following a period of training in military hospitals, but also at the Royal National Orthopaedic Hospital in Stanmore and St Thomas's Hospital in London, where I did most of my rheumatology, pain management and research training. Initially I was doing complex neurological rehabilitation as a consultant, but then I moved on to more musculoskeletal rehabilitation, so for example rehabilitating people with bad spinal pain or lower limb injuries. In 2003, following the war fighting in Iraq and Afghanistan, I was drawn into the planning and management of the complex rehabilitation program. Consequently, I spent a lot of time drawing together and managing multidisciplinary teams to provide the sort of best rehabilitation we could for these wounded and injured service personnel. I became the clinical director at Headley Court and subsequently the Director of Defence Rehabilitation, which has responsibilities for coordinating all the rehabilitation activities across the armed forces, wherever they are in the world, And that might mean someone with a sprained ankle, or it might mean someone with a complex brain injury or limb loss as a result of war fighting. It was a very challenging time, but very enjoyable and very rewarding, and I think we produced a very positive outcome for many of our patients, even the most severely injured ones. I've been the president of the Faculty of Sport and Exercise Medicine for about 12 months. Prior to that, I've been a council member and a foundation fellow since the inception of the faculty, and so been heavily involved in the development of sports and exercise medicine as a specialty, and trying to get sports and exercise medicine recognised for the valuable contribution it can make to the health of the nation through the management of musculoskeletal injuries, but also the promotion of physical activity for the prevention and management of illness and injury. I'm particularly proud of the efforts of our members and fellows in an initiative called Moving Medicine, which allows us to teach healthcare professionals to engage with patients and explain to them the positive benefits of physical activity and give them the tools to do that in the most effective and accurate manner.